now the next step is we have a depressed patient who's severely depressed. It's affecting their occupation, personal life, social life. They don't want to, they're withdrawn. They don't want to interact with people. And you see somebody just falling apart in front of your eyes. And family members do tell me this person is not the same anymore. They're struggling at work. They're struggling in their families. And there comes a time where, as a psychiatrist, if the therapist and outpatient therapy and medication management is not enough, sometimes to prevent hospitalization, I recommend a patient going to a partial hospitalization program.
Okay. What's that?
Exactly. So a partial hospitalization program is a step below a hospital inpatient, and it's a step above outpatient, what I do. And I used to work in partial hospitalization programs, and it's a great program. They're usually 5 days a week, and it's kind of like you're going to work. It's usually hours are typically like 9 to 2, 9 to 3. A patient goes there, they're getting medication management, they're getting individual therapy, group therapy, and all different modalities of therapy based on the location, such as music therapy, art therapy, so talk therapy. So they're working on themselves as a whole. And this is to prevent inpatient hospitalizations. Some people are in the programs in a minimum of 2 weeks. So that's, or longer. Excuse me.
Bless you.
Thank you. So some people are there for like a minimum of 2 weeks. And then there are cases where if the patient's not improving, or they might be a danger to themselves, they may get stepped up to an inpatient hospital and inpatient hospitalization. So that's that track from partial hospitalization programs. But then on the flip side, let's say, for example, like you mentioned earlier, with somebody being, there's a couple options. A person could go voluntarily into the hospital if they meet symptoms, especially if they're suicidal. So they could go in voluntarily. They're not detained, whatnot, and they're able to work with the hospital staff. And the same thing, a person who goes involuntarily, they don't have their rights, quote unquote, is they're like on hold, usually for like possibly up to 72 hours, and everything could vary based on state. So I just wanted to put that caveat there. But when they're in there, and once the hold is lifted, then they may have the opportunity to, anybody has the opportunity to sign out against medical advice, but a good portion of people do stay there because medication management, they're getting therapy, there's group therapy, they're like, a lot of these different modalities are going on in the inpatient unit, and every hospital is different. So many people have different experiences, and I can understand where families and patients are scared. I totally get it, because people hear horror stories, see things in media where you go there. Because I remember one time in the hospital, a guy had some passive suicidal thing, but he got, for some reason, he got admitted because he was suicidal. But he got into the hospital and he saw the severe cases in there. He was like, I won't do this again. I won't do this again. Please give me.
That was therapy within itself. He was treated, cured, automatic.
He was like, please send me I won't do this again. Thank you. I learned my lesson, But so, like, so I've seen it all. But there's cases where as a provider, like, I do see people who are hurting, and they don't want to exist anymore. And when you meet them and talk to them, especially in the hospital setting, I think that's when the real work happens, because the doctors have the ability to see which medications could work. That's where the best. I like it when patients are in the hospital, because you can now be aggressively titrate, experiment what works, versus outpatient where, based on, give you a prescription, you get bottles. And so now if it doesn't work, we have to do it all again, prescribe a new thing.
Don't know if you're taking it, not taking it.
Yeah, exactly. It's all eyes on you, 24/7. The hospital staff talks about all the patients, so they know what's going on. They're eating their meals. They're able to focus, how they get along. So this is a time where you get your individual attention, and your family's involved if you allow them. If you're an adult, you could give consent for your family members to be involved.
Okay.
And there's like a social worker, therapist, a team approach in helping this patient. And then after we get to the patient to a level where they're able to be discharged, the the support team that they're working with sets up appointments with their outpatient provider, so they're discharged and that they can make the appropriate follow-ups, or they've stepped down to a partial program. And when they're done with the partial program, sometimes they step down to an intensive outpatient program, which is like 3 days a week instead of 5 days.
Okay.
So there's a system in place that many people don't know about.
I was going to say, and who knew? I didn't even know.
Yeah, but it's that, like, a lot of the other providers from other specialties don't know this, but this is what goes on in the mental health world. And I'm very proud to be a proud member of the mental health community, because I do see the work that they do to save lives, and I encourage, like, as a provider, I make sure I cooperate with the therapists, their family members, because I'm only seeing them for an X amount of time, but they see them in the household or whatnot, and I love hearing the stories what they tell me. So I always ask, can I get a release of information so I could speak with their family members and we could collaborate? And some don't, but some do. But the more support they get, I feel there's a better chance for healing.
Say that again for the people in the back.
Yeah, the more support you get, the better chance of healing. Like, it takes a village to raise a child, and I believe in that. So you got people supporting you, praying for you, and looking out for you, helping you make your appointments, checking in on you. So if you see somebody down, they're going to be struggling in silence because they feel alone.
Yes.
Because when you're depressed, depression is a very isolative disorder.
Yes, it is.
You're stuck in your thoughts. You don't, your vision's your perspective is blurred. You don't see things going well. Like, believe me, depression does not discriminate. You could be poor, you could be rich. Depression does not discriminate. And so
we've seen it. Yes.
Seeing people who are like, you're like, wow, you got this, you have this lifestyle, you travel around the world, and they're depressed.
Anthony Bardot.
Yes.
I mean,
yeah, they're depressed. And
Spade. I mean, Robin Williams and Pookie and Ray Ray down the street.
Yeah.
All of them. And I think that's the biggest thing I picked up on my psychiatry rotation, was that the people who do the best are the people who have good support systems. And so I'm so glad that you said that. So people, don't be afraid to tell somebody. Everybody has someone that they can trust to say, hey, I am struggling. And if you don't feel like you have someone, even though I'm very sure you do, I know your wife in one of your videos said you won't know how many people will miss you and how many people will be so hurt if you do succeed in taking your life. But if you want to talk to somebody, we have to give them the National Suicide Hotline number, which is 1-800-273-TALK. That is 1-800-273-TALK, which is 8255. And so depression is real. I know you wrote an article about young Black men in college that are taking their lives. And so this thing it's very serious. And so again, I'm so glad that you're on to talk about that.